For Charlotte Greenland, the Dene way of being strong as two people is deeply personal and is reflective in her work with North Star, a new art exhibit in the NWT capital which aims to develop a culturally safer and more equitable health system for Indigenous people.
And what I found most grounding was walking into the tent and the as we say in Gwich'in, are the spruce boughs. That smell is something that's been a part of my life. You know, I grew up going out muskrat trapping in tents like this, and that smell grounded me right from the start. Step into this immersive, experiential learning project, a creation from Northern artists and scholars.
In the Northwest Territories, there were 14 officially recognized residential schools.
Audio guides participants through chapters of colonial history and systemic racism, and pays homage to Gwich'in understandings of vitai, personal strength, and gutai, communal strength.
Indigenous people never had a good relationship with Canada. All the policies and programs, everything has always been to address the Indian problem. And so reconciliation doesn't really address the issue for me. So one of the things that I like about it, I guess we have to remind people, is that this is the history has been.
It is a practice of looking inward.
As more is revealed, the portals open not only to creative expressions, but directives for better outcomes for Indigenous clients.
We will walk through the anti-Indigenous racism.
Suggestions on models of care rooted in education, language, justice, and healing. Lead organizer of North Star and Director of Community Culture and Innovation, Nina Larson, says the project is part of a territorial push for the healthcare system to better reflect culture and needs of residents.
Is to really model what we want the healthcare system to be if we think of the future of health, which is informed choice and informed consent.
The exhibit is part of a 3-day primary healthcare summit in Yellowknife, drawing upwards of 70 leaders from across the country whose work in the healthcare sector focuses on Indigenous health.
We know, like, right across the country that the primary care system is not working, and we need to think about it differently, and we need to really truly be innovative.
While not currently available to the public, organizers say it has the potential to be, based on feedback so far.
We're wanting to look at a new way of doing healthcare. Education needs to be there in partnering with that. And again, that Indigenous knowledge, the way in which we do things, the way in which we have educated our people, those are the practices that need to be brought in. Those worldviews need to be there.
Charlotte Morritt-Jacobs, APTN National News, Yellowknife.